What happens if I relapse during these 3 months until I come?
Do you recommend just shaving my beard?
How long after treatment we need to be isolated?
I'm taking Mizonant. I couldn't find it on the list, that drug that you need to stop.
And is there any natural supplement that you would advise to you?
You were mentioning about lifestyle change. Would you be able to explain better what that means?
A bit stronger exercises made my state much worse.
I lost my brain fog and I had no idea it was so big.
So now we are doing exercises with other former patients of yours.
И я сейчас уже села в инвалидное кресло.
The new protocol you mentioned is a lot less toxic. So I spoke with another gentleman that did it in 2020.
The risks of serious side effects.
He mentioned that like that chemotherapy, it causes you to like lose your hair and all that stuff. Is that kind of still the similar expectations?
Infertility.
What is the age limit of doing the procedure?
HSCT is the final treatment for life, or it may MS come back for me.
Would you be willing to give consultation to my doctor on the best possible protocol?
I had a second treatment, and unfortunately in my country and
the activation of Epstein-Barr,
I did get ATG, and I had just learned that my Epstein-Barr virus has been reactivated.
Doctors here in UK, they recommended me, actually I'm on a waiting list for a sacral nerve stimulation.
Would you advise me to not do it at all if I'm planning to do it?
I was vaccinated.
I got my Pfizer shot.
Pfizer.
5 days later, I woke up, world was spinning, nausea, couldn't walk, anything, went to the hospital.
MS started to be aggressive.
I decided not to take the medicines yet.
Like, would I get rid of my MS, or
would you recommend me to use the medicine before?
You keep measuring these patients like years after their transplant?
It's still easy to get a tourist visa.
But flight from Australia is the same like before.
Yes, that's true. That's true.
Dear friends, thank you very much for being here during my presentation. I think it was useful, and now I am ready for discussion. So welcome, feel free. Anastasia is here, so let's go.
Hello again to everyone.
Hello.
Thank you a lot, doctor, for your good news and new information. It's very helpful and nice. And of course, we already have a small turn with some questions to you. And the first lady will be with us. She's a Russian-speaking patient, I think. Maybe not, maybe family member. But anyway, to be ready, Dr. Elena will ask you some questions as well.
Здравствуйте.
Здравствуйте.
Я хотела, у меня первично прогрессирующий рассеянный склероз, и я сейчас уже села в инвалидное кресло. Я хотела узнать, как сказать, могу ли я рассчитывать на лечение вот в вашей клинике, скажем, ХСКТ или что-то другое.
Елена, я вам отвечу, а потом могу, поскольку мы в прямом эфире, перевести, ну, мы имеем живую открытую дискуссию, перевести для других пациентов ваш вопрос и ответ, хорошо?
Хорошо, спасибо.
Язык. То есть вы даете добро. Да, ну, во-первых, нам нужно проанализировать медицинские документы. Вы будьте на связи с Анастасией, есть специальные формы, application, которые необходимо заполнить. Там важна очень сильно динамика, как долго вы в инвалидном кресле, как быстро прогрессировал рассеянный склероз и какие данные МРТ вы имеете сейчас, какое лечение вы получали. Конечно, вы можете рассчитывать на трансплантацию, все индивидуально в плане эффекта терапии, но вот, как я уже сказал, в рамках моей презентации мы внедряем протокол для инвалидизированных пациентов. Ранее мы старались не брать пациентов, ну, следуя международным рекомендациям, кто очень инвалидизирован, боясь за риски. Сейчас мы, скорее всего, будем включать таких пациентов только с учетом, если болезнь прогрессирует дальше, чтобы ее остановить. Если болезнь на одном уровне, то смысла большого делать трансплантацию нет при условии стабильного МРТ, поэтому высылайте документы.
Хорошо, спасибо.
And dear friends, for other people who don't speak Russian, I will translate. The question was about primary progressive multiple sclerosis with high disability level. Can we help? Yes, we can help, but we need to analyze documents. We need to assess MS, the disability progress. If MS is progressing, we can help, especially as I told you, we develop a new approach for advanced MS. So welcome, send us medical documents. We will analyze each case individually. We'll try to help, of course.
Thank you so much for
Thank you.
question, for so important information. So maybe let's continue. We have another already patient. To be ready, doctor.
I'm ready.
We
Great.
have another nice lady.
Hello.
Hi, Dr. Fedorenko.
Hi, nice to see you. How are
Nice
you?
to see you. Well, I wish I was better.
Oh.
I've had I had a second treatment, and unfortunately, because of where I live, it was better to stay in my country, and unfortunately, they are not as good as you. And I wanted to know, I know initially you had mentioned that the Epstein-Barr virus being reactivated after the use of ATG. I did get ATG, and I had just learned that my Epstein-Barr virus has been reactivated. So I wondered what your opinion is and what you would do in this situation.
If you have clinical reactivation of Epstein-Barr virus, it increases risk of relapse. Unfortunately, it's quite known information. I recommend to use intravenous immunoglobulin G.
Okay, so their suggestion of doing 4 infusions of Rituxan.
Yes, Rituxan and intravenous immunoglobulin G in case of active virus infection.
Okay.
Rituximab should be used for prevention Epstein-Barr virus-related lymphomas and for prevention of MS relapse. But for infection treatment, we need to use intravenous immunoglobulin G. It can be combined with Rituxan.
Okay. All right. Thank you so much. I wish I would have gone to see you.
Success. I wish you success. Good luck.
Thank you.
Thank you.
Thank you so much. We will know so more experience, more news.
Yes.
So dear friends, we continue. Doctor, we have another patient who is ready to ask you some question as well.
Yeah.
Hello.
I guess yes.
Hello.
Hello.
Nice to see you.
Nice to see you too. Yeah.
Ah.
Just a minute. Well, I have 4 questions actually.
Okay, let's start step by step. I'm ready.
Yeah. The first one is how long we need to arrange the payment before we come to Russia. This is my first question.
You mean when you want to go to our hospital for treatment?
Yes. I have booked my place for 3rd of June, to be honest. So I have to know how long before do I need to arrange the payment.
This is this organization. You can be in contact with our administrator, with Anastasia, about organization question. If you need treatment earlier and we have free spots, we can organize it earlier. No problems.
Yeah, I know, but I plan to come in June because my wife is a teacher and she will be with the kids when,
June is good time. Welcome. So I'm not involved in payment details. I'm responsible for medical treatment. So if you have organization questions, maybe
I will ask Anastasia an email about my questions.
Yeah,
Just one question then.
email.
How long after treatment we need to be isolated?
Not necessary to be in isolation at all after treatment. Only we recommend to wear mask in public places during 3 months. Some patients ask me about information from the internet about 1, 2, 3 months of isolation. Not necessary. After lymphoablative protocol, you can walk outside, you can live with your family. You shouldn't use isolation. You shouldn't use special sterilization of your house, special machine for air disinfection. Not necessary. Normal life.
Okay.
Only avoid to be in close contact with sick people and wear mask in public places first 3 months. That's all.
Okay. Thank you very much.
You're welcome.
I'm from Romania, but actually living in UK.
Okay.
And I got multiple sclerosis since 2018, and I'm planning to go to Russia for HSCT as well. I've got 2 questions for you.
Yes.
One is relating infections. You said, I mean, all the information Anastasia sent to me was like, we need to be clear of infections when we go to HSCT. At the moment, I got toenail fungus. Is that like an infection, or should be treated as an infection?
No, of course, we when patient admits to our hospital, we provide complete examination. We check body for infection. This is blood infection, virus infection, urine infection. But if you have known sources of infection like problem with teeth, serious problem with teeth, you should treat it before transplantation. That's all. And also, when you send us your medical documents and fill out application, you have special position about comorbidities you have. But problem to start this treatment is acute infection, like acute hepatitis, serious infections, not something mild.
And another question, I got glaucoma on my right eye since I was a child. Would that
it's not a problem
affect somehow?
No, transplantation can't affect here. It's completely safe.
And another one about infections. Lately, I started to self-catheterize, so I did have a couple of infections, you know, urinary infections. Is there any way I can, take some treatment before I go there, so I make sure?
No. If you have acute urine tract infection, you should do cultural test and have antibiotics. It's quite common rule. When patient comes to our hospital, we provide urine test, cultural test, and situation you describe is very common, related to bad innervation of urine bladder. So during treatment in this situation, we put catheter for 3-4 weeks. Also, supportive treatment from the beginning to during all steps of treatment, we give very strong antibiotics for prophylaxis if it's necessary for infection based on cultural test. So we have very great infection disease control in our university hospital, and we have all antibiotics. So we provide cultural test, we provide test for antibacterial resistance once a week in all our patients. So, using catheter, using urine test, cultural test, we protect it here, but after leaving hospital, we give recommendation what to do. Transplantation can't make it worse.
Okay, and one more question, if it's possible.
Of course.
The doctors here in UK, they recommended me, actually I'm on a waiting list for a sacral nerve stimulation surgery for my bladder.
Nerve stimulation of your bladder, it's also optional, it's symptomatic. You can use it to compare with together with transplantation.
No, I mean, if I do it, would it affect somehow the transplantation, or it won't make any difference?
So it will help you additionally to improve your functioning. Post transplantation, this is systemic treatment. In your body, you have an immune system which attacks your nerve system. And urine system is only one of part of affected nerve system. We have lots of other functioning, and we need to stop this process. And of course, you have great chance for improvement. And after removing MS from your body. Of course, rehabilitation, urine bladder stimulation, myostimulation are very effective as a part of rehabilitation process. This is like a kind of complex, and we recommend it also.
Okay, thank you for that. And last one, about you were mentioning about lifestyle change. Would you be able to explain better what that means, like a different alimentation or?
We have different levels of our well-being, not only physical, our mental, our emotional, our psychological, and we need to remove MS from all our levels. From here, you should work hard to remove it from your mind, to avoid strong stresses, to exercise, to do something to be better with somebody who helps, like physiotherapist, yoga instructor, to eat healthy food. If you smoke, to stop smoking, because smoking affects a lot on nerve system. It's not recommended to smoke after transplantation, of course. We only give it as recommendation, but it's important.
Thank you very much for that, doctor.
Thank you. If you want to be successful, we need to do as much as we can.
Yeah, I get that.
And transplantation is only important, but only basement and one part from complex. Your family support, your relative support, your mental changes are extremely important.
Okay, thank you very much, doctor, and hope to see you soon, probably beginning of next year.
Okay, see you soon. Welcome.
Okay, thank you.
Doctor, I'm glad to hear so many information and so important. And if you don't mind, I would like to maybe add a little bit information. I think it's also important after treatment, full treatment, transplantation. I mean, not to put yourself in strong restriction. Yeah, really. Live your life. We do everything for that, right?
Yes, Anastasia is a great example of this recommendation, so you can see it.
No, just my opinion. Yeah, just
I agree with you. I agree with you completely. Thank you very much, Nastya.
Thank you too. So maybe let's continue. We have one more guy, Dr. Damian, who wants to ask. Just have small problem with his camera, but we can hear him.
Yes, of course.
So he will ask you. Please pay attention.
Hi, doctor. First,
hi, I can see you.
You can see me, right?
Yeah, a little bit. Yes.
Because I have
but
three
it's
kids
okay.
And I moved, from them. So sorry for that. But first, thank you for organizing this webinar and also possibility to ask a question. I'm coming from Serbia. I'm having a progressive one, and I have been diagnosed back 10 years ago, so in 2013. But actually, when I have when they take my liquor from the back, my doctor also saw my MRI before 20 years ago, because I had some relapses also when I was very young. And now in maybe 2015 or 16, they told me that I have now the progressive one, and my ESDDS, whatever is the name, it's around 4. Let's say I'm still walking, I'm trying to exercise. But the main question I would like to ask you is, because I'm taking Mizonat, and I'm taking maybe one year, maybe 1.5, something like that. And I couldn't find it on the list, that drug that you need to stop before taking the treatment. So for how long I need to stop before I came to Russia?
Okay, lots of new medication coming to pharmacy market. So Myazent, we know this medication, you should stop it better 3 months before admission. Better 3 months, it's okay.
So 3 months before I came, right?
3 months. 3 months before, and your condition with EDSS score 4 is good because you still are in early stage, so and your success rate is quite high. So welcome, and of course you won't need to use Myazent after our treatment.
Thanks a lot. That's the only question I have.
You're welcome. Thank you for joining our webinar. Thank you.
Ciao.
So let's continue. I hope you are not feeling tired yet.
No, Anastasia, I'm really ready. I'm very, very ready, because all these questions are not useful for only one patient. These questions are very common for many other patients and answering questions for 3-4 our friends. I think questions are very close, so and very
Absolutely right.
important. So
That's true.
let's
That's
go.
Yeah, let's continue. Yes, we are waiting.
Yeah,
Still fit.
okay.
Okay.
Hi, doctor.
Hello, hi.
I am Rashmita, and I have probably, according to the doctor, I have primary progressive MS. And so it's not sure, but I feel on my body that it's not good. And my question was, I decided not to take the medicines yet. But my question was, would you advise me to not do it at all if I'm planning to do AHSCT? Or would you recommend me to use the medicine before?
According to our result, you could see during my webinar, my lecture, previous treatment can decrease result of transplantation. So your idea not to use disease-modifying drugs is great. Of course, you can use symptomatic treatment for spasticity, for sleep, for pain, for nerve pain, vitamin supplements, but you should make decision about transplantation. If you make decision to have transplantation maybe in 2, 3, 5 years, you should use something effective now to slow down the disease. If you make decision to have transplantation in 6, 12 months time, and better not to use it. I support your decision.
Clear. And is there any natural supplement that you would advise to use?
Yes, maybe multivitamins, B group supplements, omega, vitamin D, not in like protocol, Calimbra protocol, not huge dose, normal dose, like for 5,000 units a day. So, and of course, if you make decision to have transplantation, you should prepare yourself mentally to generate strong belief in success of this idea, and exercise, yoga, fitness, something to support your muscles, your body from muscle atrophy.
Okay, so at the moment I'm using lion's mane and high doses of magnesium, and also
magnesium is palsy. Magnesium is sorry for interrupting. Magnesium, high doses of magnesium is very useful for spasticity. You can use it.
Okay.
Other symptomatic medication like sirdalut, baclofen also can be used. It's not MS treatment. This is symptomatic. Feel free to use it. I mean, if you make decision not to use disease-modifying drug, it's better not to use it before transplantation. And our results confirm it.
Okay, clear. Thank you very much.
Yeah, welcome. Welcome to our hospital.
Okay, good. Thank you again.
Thank you. Very important questions, really important.
That's true, my dear doctor, my dear chef. So, you know, one guy texted me here, but unfortunately he doesn't speak English, he's from French, and also asked if it's okay and possible or not to provide transplantation for a MS patient who doesn't have active lesions on MRI.
MRI activity isn't so important for transplantation because, as you know, as many patients have progressive MS without active lesions. So disease progression can be clinical when MRI is stable, but clinically patient progresses. Radiological, patient can be okay, but MRI is getting worse, or both, clinically and radiologically. So only if patient is clinically stable 1, 2, 3 years and MRI stable, we can watch and wait and to go to treatment in case of any variants of progression. If patient has clinical deterioration, transplantation should be done in spite of absence active lesions. We analyzed 2 groups of patients with MS progression, without active lesions and with active lesions before transplantation. No differences in long-term positive results. So also according my presentation, we didn't find MRI activity as positive predictor factors. So it's not necessary to have active lesions.
Seriously considering HSCT, but I'm scared of the risks. And I was wondering if you have any statistics to share about the risks or side effects like other immune diseases. It was mentioned today, the activation of Epstein-Barr virus, infertility. Yeah, I have many questions about the risks and likelihood of serious side effects.
Okay, your questions are very important. So it was in the first part of my presentation. This is why we developed protocol from myeloablative with high risk of secondary malignancy, secondary autoimmune disorders. It can be, you can find it in the internet, it published, and a risk of infertility, risk of death, but our new program we have been using more than 4 years. Also, our old lymphoablative program doesn't affect high risk of serious problem. And situation in with early MS, like your case, low EDSS score, less than 4, you have 1.5, is unique because success rate more than 90%, risk of mortality of serious side effects 0%. Only 2 long-term side effects using new protocol, hearing loss and short-term fatigue or low level of energy. What about secondary cancers, autoimmune diseases? This is question to old, very aggressive anti-cancer protocol. The risk, if we use good lymphoablative protocol, is the same like if we don't give transplantation, so not higher to compare with general population. On the other hand, many disease-modified drugs neurologists use for in situations like yours are much more toxic. Infertility is also 0, but if patient wants to plan pregnancy, you can provide cryopreservation. But about infertility, you can ask Anastasia. She can have her experience. And about Epstein-Barr virus reactivation, we don't use ATG, and we haven't had any cases of reactivation given rituximab, so our percent is 0. Of course, we have some toxicity, but mild and temporary, and actually well controlled. So,
and what would you say? Sorry, what would you say to a young lady like myself in terms of what I can expect in terms of success after doing HSCT? Like, would I get rid of my MS or?
Oh, I see you. I know your EDSS, relapsing remitting multiple sclerosis, 95% based on statistic. But your personal chance should be 100 if you go. No doubts.
Thank you.
Of course, it's true. It's our statistic, 95% based on event-free survival curves.
Yeah.
It's statistic, yes.
And you measure these patients you keep measuring these patients like years after their transplant?
Yes, we are monitoring patients. We are in contact with many patients. If patients agree, we send questionnaires. We control situation, and we are university hospital. We are not only treatment department. We have very good, very strong, powerful scientific and research department, postgraduate students, statisticians. So we publish and make reports in international conferences. So European Bone Marrow Transplantation Group invites me and my colleagues every year to share our experience, and we publish articles. So it's based on science, not from me, but from science, data-based information.
Thank you.
Data-based information. So feel safe.
Thank you for that.
You're welcome.
Thank you so much again. So
welcome.
Good to know. So also we have one more lady, Elena, who would like to ask you some questions as well, my dear doctor.
Great. I'm ready.
Good.
Hello.
Hello to everyone. I have 3 questions.
Yes,
First of
Elena,
all,
welcome.
I will introduce my form of disease. It is, as my doctor explained, a very active RR form of MS. It means that it seems that I have relapses almost all the time, and I feel them. And you have just mentioned that we should prepare ourselves for HSCT with exercises. But I have a huge problem with exercises, having in mind that a bit stronger exercises made my state much worse. I don't know if it is going in relapses or just somehow it decreasing my all possibilities.
Okay, may I answer your first question? It's important, and your question is very interesting and important. Sorry to know that your MS is highly aggressive, and I want to tell you that transplantation is the best and only single option for very aggressive relapsing remitting multiple sclerosis. So you should do transplantation as soon as possible. If in other situation we should wait, we should prepare yourself for you, the sooner the better. Also, if you have inflammation in your body, intensive physical activity can make you worse. So reduce it. Inflammation, because if your MS is, you have relapses all time. So you have inflammation in your nerve system. So this is why intensive exercising makes you worse. You should do it gently and slowly. Listen to your body. Do gently only to protect you from muscle atrophy. Now you go a little bit ahead, disease sends you back with exercising. When we remove MS from your body and rebuild your immune system, you will be much more effective with rehabilitation. But now keep it slow and gentle. Don't prepare yourself. We can combine our rehabilitation team will help you during treatment in hospital. We have this opportunity, so I recommend you to plan transplantation in other centers or in our hospital. In any center, you prove as soon as possible, because highly aggressive MS this is only one treatment option. Another important thing, American recommendations, FDA recommendation, Food and Drug Administration. This is the strongest American society for drug and treatment approaches recommendations. They recommend transplantation for aggressive MS as the soonest and first option. So for other disease variants, it can be second, third line option. For very active relapsing remitting MS, this is first option. So make decision, and welcome if you make decision to visit us or any other center.
Okay, I have already made decision, and I'm coming in February. So
great.
I believe that I will see you, and we will finalize this process. Hopefully. The other question is maybe not so popular in the medical society, but I was vaccinated with Pfizer in 2019, and from that period my MS started to be aggressive and different that it was before. I'm wondering if that vaccine made some trouble in my immune system. I'm wondering if HSCT will treat it properly and somehow, I don't know, remove its activity in the body.
Yes, of course, HSCT will remove it completely. And why we don't recommend routine vaccination after transplantation, that vaccination can be trigger MS relapses, especially in case of very active and aggressive MS. So I recommend you not to have vaccination before.
Yes.
Based on your experience, don't have vaccination from now to admission and after. Only for very emergency situation, we discuss it separately, but no COVID, no flu shots, vaccines.
Okay. I also plan not to take any vaccine.
The idea of transplantation to remove completely wrong immune system. So we will remove it completely. We will clean your body from this immunological mistake you had before, and you will have absolutely new immune system. So we will improve it.
Okay, and one more question. I hope that I'm not so boring. I have a brother, 1 year younger brother that also have MS. Do you have some results regarding treated siblings with HSCT and is this similar results or different, having in mind that after my treatment, my brother is also thinking about it?
Yes, it's hereditary MS, based on our experience or some international experience, hereditary MS can be a little bit more aggressive. For transplantation, it doesn't matter. We have huge experience, more than 2,000 transplantation for MS patients. So also we had patients, mother and son, father, brothers, sisters, not very many, but around maybe 50 cases of hereditary MS. And we didn't analyze it additionally, but based on my memory, we don't have any specific things for hereditary MS. I think the success rate will be the same like for other situations.
Okay, thank you.
Of course, I understand that it's not very easy to have brothers and relatives with MS and to receive quite expensive treatment. But if you have brother with MS, so we can help also.
Oh, thank you very much.
You're welcome. You're welcome. So we are looking forward visiting you in our hospital.
Yeah, it's coming.
Okay.
Thank you.
Thank you. Welcome.
Thank you, doctor. So good that we can see already our future patient. It's nice.
Great.
Yeah. And anyway, let's continue. Let's wait one more guy with questions for you, doctor. Jeff prepared some questions for you too.
Great. I'm ready. Hello, Jeff. Nice to see you.
How you doing, Dr. F?
you?
Good to see you again.
Great. How are you?
Very good. I assume you still remember me from 2013. So my question is, well, unfortunately, after transplantation, I had great success from year 2 to probably year 7. I had great success. And then I started to also decline since that point. I'm looking at getting a second transplantation treatment here in the United States. And my question is, because I have a lot of confidence in you and your protocol and your experience, would you be willing to give consultation to my doctor on the best possible protocol if they are open to listening to your suggestions?
Yeah, this is a very important question, and I am very sorry to know that MS came back, and so progressive MS is successful after transplantation 75-80%. Unfortunately, 20% of patients can fail this treatment. Sorry to know, and of course we developed second transplantation protocol. Our protocol is unique and it's related to first one. So in this year you had cyclophosphamide-based protocol. I know that American doctors use cyclophosphamide, the same protocol, but instead of rituximab ATG, they will give you almost the same protocol with high risk of Epstein-Barr virus reactivation. What we recommend to you, doctor, I am really want to be in contact with your doctor, but maybe they have some restriction of using our protocol in the USA. This is quite hospital rules and maybe some regulations. Our protocol is based fludarabine with rituximab. For you, it's the best option. Of course, only our hospital give additional chemotherapy inside of lumbar spine together with systemic chemotherapy as a part of second transplantation. I am not sure that they will follow my recommendation. I am open to discuss it with your doctor. So,
I appreciate that, sir.
So I'm open. You can give my contacts. We can chat. We can have talk. We can contact through via email. I will try to explain what's better for you now. But if you fail with your doctor, welcome to our hospital. Now it's possible. We have American patients now, and we had some patients in spite of this difficult situation. So Australian, American, now we have one lady from the USA in our hospital, so no problems at all.
Thank you, sir. I appreciate it.
You're welcome. Keep me posted.
Will do. Thank you, sir.
Good. Thank you. Bye. Difficult situation because American doctors can't follow our rules and
have maybe different opinion, but it's good that we know about such experience, and really cool to see our former patients, because Jeff was a patient even before me, I think.
Yes.
Because
yes.
unfortunately I didn't see him in life. We connected only by internet.
Okay, but we need to think about patient success, so we are ready to discuss.
Definitely.
So we need to keep back regulations and instructions and to try to find solution here. So
That's
we are
true.
happy to help.
Yeah, and of course, important to know, please, if anybody wants to share experience, to update about situation, condition, good or bad, good news, bad news, problems, we are always open to discuss, to help, because we are also interested in our job, in good results, and to help patients as well. And right now we also have a call from our former patient, Lady Laura. She wants to take part. I think she experienced.
Oh, hello. How are you, Laura?
I'm very good, thank you. How are you doing?
Great. Nice to see you.
Oh, you too. You know, it's been in March, it's going to be 1 year. So I'm in my roller coaster year, and it's been amazing. I'm going only up, and I'm
great.
And I wanted to say really great thank you for the all that we do, and how you treated me, and all of the stuff, and every person I met on my way, and also my aftercare attention that you are giving me. I'm very, very pleased, and it's it's very important for a patient not to feel abandoned after you go out from the door. And, it's amazing. Thank you so much.
Yes, psychological support is one of keystones of success. So it's important. Thank you for your feedback. Thank you, Laura.
I wanted to tell you that approach that you mentioned, that you have to go in psychologically prepared. To me, it was easy, but this because it's me. But it's very important. I am now in contact with some other people who had this treatment, and we all feel like winners. We conquered it, and we did it, and we are very happy.
Laura, I absolutely agree with you. And your experience can inspire new patients who are worried about this treatment, who have dilemma to do it or not to do it. And if you and other friends share your experience, inspire patients to go ahead, it's great. I think you remember you need it before treatment. and now you understand that you can help. And so I am very thankful for your feedback and for support other patients to make right decision, also to follow through the difficulties.
That's very important. For me, I realized the very, very important thing was that I lost my brain fog, and I had no idea it was so big. And life quality from already this one fact, and my fatigue is gone. Everything else I see as a huge benefit, as a big, big bonus. And I really want to thank you all for that.
Yes, I agree, especially in early stage of MS, when we don't have disability, when we can run. MS can cause lots of trouble and problems: fatigue, brain fog, concentration, memory, low energy, activity, bad sleep, lots of difficulties. So quality of life and symptoms control is very, very important. So, and thank you for your feedback.
I'd ask you one question from another friend of mine.
Great.
Who is having this, and he's asking, what is the age limit of doing the procedure?
Great question. So European and American protocol started from 55. Now we have experienced 65 to 70, and now we are waiting for one lady 70 years old with active MS. But of course we provide careful examination. So I think till 70, but decision should be individual, and we will provide more careful examination based on heart, lung, organ functioning. So actually in hematology there are no age limits for transplantation to compare with previous years, because new protocols getting safer and safer, supportive treatment is getting better and better. So the most important questions: do we need to give this treatment for patients in 65, 70 years? So if patient has active MS, why not? So now our limit is 70, but future will show maybe 80.
Amazing. Thank you so much, and
You're welcome. You're welcome. You're welcome, Laura. Have a lovely time. Let's be in contact. Great.
Have a nice night. Thank you so much.
Bye-bye. You're welcome.
So nice, doctor, to see our patients
and very
and
important
to know.
questions. Very important questions again. I think during our live discussion we cover lots very important scientific and clinical topics, and this information will help a lot for other people who didn't join our webinar and our live discussion, and so can see this talk in future. Great. I'm happy with all these questions.
Absolutely agree. Yes, for sure. So anyway, let's continue. We have one more guy. Boris wants to ask you also some questions.
I am ready.
We are waiting.
Hi, nice to finally meet you, Dr. Fedorenko and Anastasia.
Hi.
Yeah, I'm scheduled to come January 2025, so can't wait
Welcome.
to come.
Looking forward to meeting you.
Thank you. I had two questions. So my situation is actually very similar to Yelena's situation. In April 2nd, 2022, I got my Pfizer shot, my first one. 5 days later, I woke up, world was spinning, nausea, couldn't walk, anything, went to the hospital, and they gave me diagnosis of remitting relapsing MS. And then after that, I had, a relapse after 7 months. And then the next one was after 5 months. And then after 2 months. And then it came very, very frequently. So I think I have like a very aggressive form. Haven't gotten like a diagnosis from a doctor, but I think that's what it is. It's very aggressive. So I'm glad that to hear that, the treatment is gonna help kind of clear my immune system, that something's gone wrong there. I'm not saying that Pfizer caused it, but my health has declined drastically after I got that vaccine. So it's kind of like a second chance at life. So I'm definitely looking forward to that. So just two questions. One question was the new protocol you mentioned is a lot less toxic. So I spoke with another gentleman that did it in 2020. I'm not sure if he did the same protocol or not. He mentioned that like the chemotherapy, it causes you to like lose your hair and all that stuff. Is that kind of still the similar expectations?
Absolutely, because this protocol is also very, very strong, and everybody loses hair after transplantation with with new protocol. It's less toxic only for heart, lung, kidneys.
Okay.
So, and you're absolutely right. According general medical neurological rules, 2 and more relapses per year is considered as aggressive multiple sclerosis. So you have indication for quick transplantation. So I'm really happy to welcome you in January 25. Right decision.
Looking forward to seeing you, Ben. And then last question was, do you recommend just shaving my beard? Because I saw in the protocol.
No, we can help you with this. Maybe not necessary to do it beforehand. Also, usually patient loses hair in the end of treatment. Sometimes when we put catheter, we recommend to shave in local area. And later, if you want to shave, our staff will help you. No problems.
Okay.
Not necessary to prepare yourself, especially shaving. So, see you soon.
See you soon.
Super. We know one more guy.
Beautiful people are coming with very quick with very strong, strict indications for early transplantation with aggressive MS. So it's amazing to help.
Yeah,
now.
That's true. That's true. That's really nice to know people are ready to come. It's nice. Also, maybe we'll add some information about organizational area from my side that Russia is open. We didn't close our borders. I mean about visa. It's one of the most popular question. It's still easy to get a tourist visa for 3 months. Everybody who wants to come, everyone gets our invitation for tourist visa, and everybody apply for visa in Russian embassy in your country, and you come to Russia, no problem. Just problem, of course, with flights, with Europe, America, Canada, we don't have direct flights, but in that case, no option, only using few flights.
But flight from Australia is the same like before.
Yes, that's true. That's true. That's true. It's the same flight, the same few flights, only in one direction.
Anastasia, thank you very much for your comments, because it's really important to understand that in this maybe temporary difficult, I hope, times.
We hope, we hope
yes,
to.
It's true to understand that hospital works in the same, like previously we have all medication, everything is okay here, everything is okay in Moscow. Many people who comes to hospital have additional 3 days before flying back, and they have opportunity to see city center, to have some kinds of excursions, city trips. So, and also if some patients worried about situation, of course, not from me, they can ask other patients in Facebook and Instagram about who had this treatment or who are now in hospital about situations. It's true that situation is very positive here.
Yeah, we are lucky still. What can we do?
And of course, in spite of all situations, we need to help people in the best way. Medicine is medicine, so we are ready.
Yes, you're right, doctor. So anyway, let's continue. We have a few maybe more questions, comments from our also former patient, from Maria. So.
Hello.
Здравствуйте.
Здравствуйте.
Добрый вечер.
Добрый
Очень рада вас видеть. Oh, so sorry, I'll continue in English. First of all, I want to congratulate Nastya. I'm really, really excited to see you. I'm really happy to see you.
I know that you are doing well.
Very, very well. And thank you ever so much for everything you've done for me, because you literally changed my life completely. Great. I can just say that 3 years ago, 3.5 already, well, now the things I'm doing now, I couldn't do half of it like 3 years ago. So you completely changed my life.
Amazing. It's amazing. And your example is the bad confirmation, because to compare with my dry curves, your life confirmation is much, much better.
Thank you. Yeah, I also wanted to let you know that me and a friend of mine decided to make a group of exercises. So now we're doing exercises with other former patients of yours, and and other people with MS who are actually coming next year to you. Two of my friends, I'm helping two of my friends now with their application and everything, and they're coming next year to you.
Great, great. Maria, I am very thankful because you spend lots of energy not only for yourself but for other people to help. And as I tell all time, proper rehabilitation, psychological support, healthy life, patient to patients, patient to medical staff communication are the most important factors to increase success. And you do the best to help us. So thank you. And
no, you do the best to help everyone, and I really miss you guys, all of you.
I miss you too. So
the best.
I hope I will see you soon in Moscow. Welcome, welcome.
Hopefully,
I think you prefer summer months because you can have city trip. So welcome. I will be happy to see you as soon as you can.
Yeah, me too. Okay, have a lovely evening, and thank you so much for this webinar.
Thank you for your support. Bye.
Thank you. Bye-bye. Bye.
Bye-bye. See you soon.
Cool. Thank you, Maria. I'm also happy to see you, to hear from you. It's nice. And I'm glad again because Maria takes part in our webinar, I think, every year. And it's nice.
Yes,
we are in contact.
It's really important.
That's really good. Thank you. Thank you again. So, Doctor, we have one more question, but it's more maybe about organization and for everyone can be helpful and useful. We have a question from our patient. How can you send the results about MRI neurologist after treatment already? And of course, we are ready and we would like to get that information after our treatment from our hospital. So you can send just report of MRI, report from your neurologist to us by email. In case if we have any problems, if something, I don't know, maybe not understandable, not clear, or some doubts about results, we will ask to send us already pictures of MRI. But
or link.
Or link, yeah. No, I mean, if we have problems, if patient have problems after treatment, symptoms, deterioration, or active lesions or not, of course we will ask more details. But at first, report about your MRI results after already transplantation. You do MRI at home in your country and send us a report. And then we will see, right?
Anastasia, yes, thank you. It's important. I will add one important thing. So as Anastasia explained, firstly, report by email, on paper, neurological status description, blood test results is enough for us. Secondly, if we need to analyze more deeply, we will ask pictures or links. But when you go to MRI specialist after transplantation, please compare your next MRI with our CD, not with your old MRI, but with CD we give you before leaving hospital. We provide MRI according international rules. All our CD you can read everywhere. So compare your next MRI with your latest one, and this is our MRI. Other MRI can be compared with your latest one, but first MRI after transplantation should be compared with our CD. It's important.
Yes, thank you. That's true. It's really, and send to us all the time. We are really happy to know about results.
Okay, and
please don't disappear. Yeah.
Yes.
So one more patient we have with questions, doctor. Let's wait and to be ready to reply.
Yes, I'm ready. Hello. How are you? Oh, no, I don't hear you. Sorry. Maybe
I'm
microphone.
fine.
Oh, I'm okay. Now it's okay.
Now it's okay because I'm outside right now.
Okay, good. Now
I'm a MS patient since 15 years old, 15 years ago, since 2008. I make appointments to come in Moscow in 2025 on February.
Great.
But I have some questions. Now I'm leaving Thai Sabri. It is my first time that I leave the medicine since I diagnosed in MS. So what happens if I relapse during these 3 months until I come?
I'm not sure that you will have relapse because Tizabri provides only temporary effect, but sometimes it's possible. But you can use steroids, short course of steroids, cortisone, salumidrol, 3-5 days course. It's okay to have these steroids to improve your condition before transplantation.
Okay, another question. I want to know, is the HSCT is the final treatment for life, or it may MS come back for me after 5 years, 6 years?
No. It's considered a curative treatment. And we are waiting for complete removing the disease, not for 5 or 10, 15 years. So somehow the earlier we do, the better. But we have patients we transplanted in 2010, 2011, 25, 26, and our second patient from 2000 when we provided transplantation in St. Petersburg, second transplantation in Russia. She is doing well. Of course, sometimes relapse happened. So this is why we developed second transplantation protocol, but we haven't had transplantation number 3. But we consider this as curative. Huh?
Sorry. It may have a second transplantation?
Transplantation considered as a curative treatment using only one transplantation.
Okay.
So you should think about only one transplantation with 90% success rate.
Sure,
not
doctor.
For 5
it's
years,
only
not
one.
for 10 years. Yes, for all your life.
Okay. Thank you, doctor.
You're welcome.
See you on 2025.
See you soon.
Bye-bye.
Bye-bye.
Cool. So yeah, everyone stay positive. Only one-time treatment and the best result forever.
Great.
Yeah. So we are finishing, doctor. Just maybe one small last question about transplantation for patient with high DSS higher than 6.5. About how long will it be taken? Is it the same 1 month or will it be longer with such a patient?
No, the same 1 month. The same 1 month. This is the same 6 days protocol with additional infusions and lumbar punctures during these months. So this is different combination of medications, but not longer. 1 month is enough. So it's important question. So maybe I should change my presentation to
not change, just add a little bit more.
Yes, maybe to add some information. So do we have other questions, Anastasia?
Already not. Unfortunately, or maybe a good sign, people understand and know everything. To be honest, I have to know that all our patients are very highly educated about transplantation and sometimes know more than me, much more than me.
So, Anastasia, thank you very much. Thank you for sharing your positive energy in this late night, this night time. So I'm very thankful for all people who join our meeting, who ask very wise and important questions. So I wish all people Merry Christmas and Happy New Year. They're coming. So to stay positive, to stay motivated, to use willpower to fight all difficulties. Also, thank you very much our team who prepared this webinar. So we are here on the center, but our friends, our colleagues have to work hard to prepare this webinar. So thank you, our organization team. So, and our patients who are coming in the closest time, we are waiting, we are ready, and have a nice time.
Yeah, thank you again from me also, from Russia with love. See you.
See you,
All
bye.
the best holidays in future.